Does your child often go to the office at school because they just don't feel well? Does your child have meltdowns or just a lot of big feelings on the way to or from school? Does your older child miss a lot of days of school because of just not feeling well? Or do they sometimes just plain refuse to get out of bed to go at all? So what we're talking about now is anxiety as it relates to school avoidance behaviors, and even school refusal. And for this, we're joined by a local expert in the subject, Kristen McNeely. Kristen, thank you so much for joining me for this. Really appreciate it. I'm Dr. Chris Tolcher, by the way, with Parkway Pediatric Medical Group. Kristen is a licensed marriage and family therapist. She's also trained as a board-certified behavior analyst, or BCBA we call it. That means she's got extra training in dealing with children with behavioral problems, management planning, and really working in the space of children with developmental conditions, including autism and related problems. She also has been trained in a special technique we're going to talk about for dealing with anxiety called SPACE, supportive parenting for anxious childhood emotions. She's also the mother of 3, which to me is the biggest qualification of all. And she has a local private practice in the area that specializes in these subjects, helping families with kids with anxiety, ADHD-related conditions, school avoidance, school refusal, and you even help people with the 504 plan and IEP processes as well. So a good resource if you're looking for that. So I thought we would start by just kind of bird's eye view, talking about really helping people with understanding anxiety. So we often say, I know that there's a certain amount of anxiety that's normal. We need it to be good at what we do. But when is it a problem? When does it cross that line? And what does it look like for kids?
So for kids, it can look like a whole variety of things, really. It can start out with them just saying, my tummy hurts, I don't feel good. It can look like just a typical avoidance. So, I don't want to go there anymore, all the way, down the spectrum to I don't want to go to school at all. It can look like sleep disturbances, or it really can just look like, are you sure that everything's going to be okay? Are you sure you're going to be okay? Are you sure I'm going to be okay? So a lot of reassurance seeking. So it's really different with every kid, but understanding what we're looking for can be really helpful.
And I imagine you see this too, but I see it almost evolve in ways from younger to older. It can start with really significant separation anxiety or specific fears of the dark, fears of doctors, fears of dogs. And then it can morph into like general anxiety, social anxiety, which are big in the space of school problems, right?
Definitely. So separation anxiety is very common. We would even say that it's normal in toddlerhood as kids are, growing and developing, but it can certainly last. And once we're in that kind of later preschool, kindergarten age group, if it's still persisting, that's when we start to get a little bit concerned. To go back to your previous question, we also get concerned when it is impeding on normal life. So if a child is so anxious that they are not wanting to go out and do things that they normally would like to do, or they're not wanting to see people they normally enjoyed seeing, that's when we start to get concerned. But what I love talking about is before we even get there, there is so much that we can do to handle these little very benign worries to prevent it from really growing into something more.
Oh, I love that. We're going to spend some time on that today because we want to get things, even in both of our worlds, prevent it from getting worse.
Exactly.
Treat it a little bit so you don't have to treat it more down the road, right?
Exactly.
Okay. When would you say, so let's say I'm a parent and my child has a bit of separation anxiety or fears of this, that, and the other. When does it cross the line from that's just how they are to I should be concerned? And when should they reach out for professional help?
For me, I truly believe there's no too soon when it comes to reaching out for professional help. And what I love about SPACE in particular and the work that I do is because it's with parents, there's so much early intervention that we can do. It's not uncommon for me to see a family for 4 to 6 sessions and then kind of send them on their way because they've learned new language to talk to their kids about anxiety or in responding to their kids' anxiety to the point where their child is kind of accepting these new responses and is no longer avoiding the things that they were.
One of the reasons, and I imagine you're going to agree with me on this, I believe, if not, feel free, is that one of the things that seems so important is that I'm a parent as well of 3. I even have grandkids now, so I'm in the second level. But I have a bit of anxiety myself. I have some, and my girls have a bit more. Go figure. So what I learned the hard way through the years is sometimes what I thought I was doing that really was helping, my instinct as a parent to keep reassuring them, to protect them from difficult situations they were afraid of, was actually not helping. Now, we'll dive a little more deeply, but I want to just set the bar by saying that it's okay that parents, our instinct sometimes isn't always what they need.
Yeah.
True?
Yeah, absolutely true. I think it's very instinctual for us to want to talk about feelings. We hear how important it is to be, aware of feelings and teach kids what feelings are and how, they can help themselves if they're struggling. But sometimes we talk too much. And that can just kind of make that anxiety cycle go on and on. So yes, there are some really kind of easy things that we can do to support anxious kids that might go against our initial instincts, but once we have some practice, they feel a lot more natural.
And I also want to touch on the difference between obvious anxiety and subtle anxiety. So sometimes when we think of anxiety, we tend to think of they're afraid, they have a specific fear, or they're overly worried, right? And that's true, those are anxieties. But there are, I see a lot in my role as a general pediatrician where the way they come into the office is not that I'm afraid, but I have a lot of physical complaints.
Yes.
So it shows up, and you referenced it a moment ago.
Yeah.
I see a lot of kids with chronic headaches, chronic stomach aches. I'm tired. Like anxiety is exhausting for the body, especially as they get older, right?
Yeah.
Sleep problems. Do you find that that's common, that kids will show up and parents are surprised to learn how anxious their kids are?
Yeah, I think that definitely happens. And, if they have not associated it with worries, then that might be what ends up bringing them into the pediatrician's office. They're having a stomach ache every day before school. What's wrong with their stomach? Anxiety is almost always accompanied by some type of physical or what we call somatic complaint. So the stomach aches are super common, and that can be just kind of general stomach ache all the way to something like emetophobia, where a child is vomiting and is now afraid of vomiting again. So yeah, it runs the whole physical spectrum. And that's because anxiety triggers a actual physical response in our body. So when we have these worry thoughts, our body kind of goes into that fight, flight, or freeze mode, and anything that's not important for our survival shuts down. So our digestive system shuts down, and that's where the tummy ache comes from. And so I think part of what can be helpful for parents is understanding, okay, this is actually a real thing that's happening. They're not saying that their stomach hurts to avoid. Their stomach really does hurt. We just want to teach them to work through that fear, because the only way to make their stomach not hurt is actually experience that what they're worried about isn't dangerous. It's just scary.
Oh, that's so good, because I encounter a lot having that insight, helping families with the insight that, like, there's a tendency when a child comes in for, I see a lot of kids with my stomach always hurts, right? And my job is to rule out the medical and make sure we're not missing something that needs like a change in diet or a medicine, right? But a lot of it is not physical bowel. It's, as you said, it's bowel symptoms. And sometimes it's hard for parents to accept the fact that I'm not just saying, are you saying it's just all in their head?
Right.
Right? And in a sense it is, if it's, but it's not made up.
Yeah.
It's a legit pain that just is their main complaint.
Right. It's a legitimate pain. It's just that it's due to their worry, not a medical problem.
Absolutely.
Yeah.
So this is important that parents know that there's a lot of different ways anxiety problems can look. And generally the way I look at it, and I think you'll agree with this, Kristen, is that to me, what I tell parents, when it crosses the line from normal anxiety to it's a problem, is when it's causing problems.
Yes.
It's usually persisting, like it's not just a week or two, it's not a bad week or two, it's severe. It's like worrying or symptoms beyond the norm. And it's really kind of disabling or distressing to the child. It just blocks their functioning.
Exactly. If it's stopping them from doing the things that they would normally be doing, playing sports, seeing friends, attending school, that's when we really are definitely concerned.
So let's now flip and talk more about anxiety as it relates specifically to school, which is really the meat of our conversation now. So let's say I'm a parent who has a child who's not diagnosed with any anxiety problem, but doctor, my daughter keeps going to the office saying she doesn't feel well. It's often my tummy hurts, or it's just I don't feel well. I want to talk to my mom. So when a parent sees that, let's say early on, like in early elementary, what should they do? How should they look at that?
Well, I think some first steps are really validating that for the child. I hear that when you're in school, your tummy kind of starts to hurt, and that doesn't feel good. Nobody likes to be at school not feeling well. I think parents can do some exploring in terms of, when does that happen? Is it always, in PE, or is it always when you're about to take a test? Understanding some of those triggers can be very helpful. But then the message really, we want it to be that despite that feeling, we believe that you can handle it and you'll get through it. And we have supports to help you with that. And that's really the heart of space, which I know we'll get to in a little bit.
We will. And that's kind of really the heart of is building that, what we call resilience, that ability to kind of recognize a challenging situation, see it for what it is and overcome it and thrive despite it. Okay.
Exactly.
Okay. Gotcha. And so, if a parent is there a situation where, in that example I gave you, where a parent is, let's say, because our instinct again is to protect our kids from that negative emotion, that negative feeling, and take them from a stressful situation. How do you help parents through that, seeing that it is important to not just contribute to their, I don't want to say contribute, but help them out in their avoidance,
Yeah.
as
Yeah.
opposed to giving them that
Yeah.
resilience.
So one of the things that I loved about doing the space training with Dr. Leibowitz was he talked about how humans are the only mammals where there is this natural instinct for distressed children to go to their parents, and parents seeing their child in distress to want to protect them. So first of all, normalizing. None of us want to see our kids in distress.
Absolutely.
It's awful, right? So we start there. And then the thing that I typically go into next is helping them understand what is the anxiety cycle, helping them to understand that it is this very predictable pattern where we feel anxious, there's something that's bothering us, we have this physical reaction that's really distressing, and our instinct is to avoid.
Exactly.
And when we avoid, we feel better. And so our brain learns, oh, okay, I remember that last time when I avoided it, I felt better, let's do that again. And it becomes this very vicious cycle, and it often snowballs. So when we avoid something small, the next time it might be bigger, and it kind of goes from there. And so helping parents to understand this isn't something that you're doing wrong. It just needs a different approach. And when we understand that anxiety cycle and can kind of help kids understand it too, it really does demystify what they're experiencing. And I think it helps them to feel a little bit more in control too.
So what about the child now? Let's say we take it a step further. They've been missing a good bit of school, right?
Yeah.
So now because the parents come pick them up, the child's crying in the office, they're having bad belly aches. They go to someone like me and I say, I rule out it's not, food allergies or stomach flu or celiac disease or things like that. And now it's back to what do we do about that continued avoidance and also reassurance seeking. I guess it's both, right?
Yeah.
So what does the parent do if it's like, you've done the teaching, they know what it is, but they just still seem, what's the next step? If they just still seem to be missing too much school?
Yeah, well, hopefully there's a really collaborative plan involved where the school is participating and parents and child. And so we would want to start by looking at, are there things about school that are making it particularly hard? So are there possible bullying things happening? Is there a learning disability? Is there something like ADHD where regulating their attention is really challenging? Other social, just maybe difficult friendship things. Maybe it's not bullying, maybe there's some just tricky friendship things happening. Understanding those things is really important. We look at that as the function of school refusal, and there's actually like some assessments that you can do to help determine that. And it's important because it's not that we want to then remove whatever is the barrier, but we want to scaffold some skills in managing that. Also, if there are learning...
Can I stop? By scaffolding, do you
please.
mean gradually building the skills?
Yes.
Just want to explain that.
Yep,
Okay,
exactly.
gotcha. Good,
Gradually
good.
building whatever the skill is that's missing. And then some things may require an assessment by a school district, either for a 504 plan or an IEP. The student might actually be needing more support at school. Even if none of those things are there, if it's, we ruled everything out, it's just anxiety, a school can still assess, right? That is still part of criteria that can qualify a student for assessment. Before any of that happens, though, I think just having an open meeting with a school team, principal, school psychologist, counselor, depending on what, is it middle school, high school, things like that, can be very helpful because school team members only know what they know. And many times they really want to be very supportive in getting a child back to school.
And since we're now talking about the collaboration, which is so important for all these things between parents and the school, what I said a few minutes ago about sometimes we parents, our method of approaching it might seem like the right thing, but might actually not be helping. Do you also see that schools, what can they do better in this process in terms of being a better collaboration with families or even approaching it in a way that actually is helpful?
Yeah. So one of the first things that stands out to me is when a student is what we call chronically absent. This means that they're missing 10% or more of school days. Districts will start sending what they call truancy letters to the families saying, your kid is missing too much school, it's your job to get them here. If you don't, here are the consequences. And it sounds very
It's a pretty threatening letter. I've seen those letters. Yeah.
It's a pretty threatening letter. Actually, some of the work that I'm doing in my practice is revising that letter to offer to schools that is a much more supportive and collaborative letter. So yes, that is one thing that schools can really be doing is being very collaborative. I think because this problem is not as It is very common, but people don't realize how common it is because there is so much shame associated with it, I think, that we don't talk about it a lot. Sometimes schools really feel like parents are just not doing enough to get their child to school. They think they just need to stop calling them out, stop excusing their absence, let there be consequences for their absences. And really that very rarely works. Especially when anxiety is at play, it's not going to work. And so I think for schools to take a step back and understand how stressful this must be for parents when we're talking about a child with what we call entrenched school refusal. So they've been out for months at this point. Parents are often missing work. Many times they have to leave their jobs. Siblings are affected. Marriages are usually impacted pretty significantly. It's a whole family dynamic issue. And so I always try and help schools understand kind of from the get-go the level of stress that the family is experiencing, and come at it from a much more supportive way. And I'm hoping that by supporting schools with kind of adjusting those letters, that it will get things off on a better foot. Because I think sometimes by the point that families have gotten to me, there's already so much disconnect between the two. And it can be really hard to repair because there's a lot of hurt on the parent side.
As you're talking, I'm thinking, I wish we got to know each other years ago. It's my fault because I can think of several pages that come to mind that I wish I had seen you sooner before it got to the point of really the truancy letters and the lots of missed time at school. So I think it goes to make the point that there really is, there's a team of people that work together to help these kids, these students, patients, families, people like you, people like me who are here to rule out the medical, and also the school's staff. I can even think of in my world where I'm sometimes presented with these, can I get the home hospital program, or can I get a letter that's saying my child can miss the last 3 months of school? And I really struggle with that. And through the years, I haven't reached out to people like you, full disclosure. I mean, it's kind of making me wish I did, because like parents, we all want the kids to do better. Nobody wants to do harm to the child, right? But sometimes finding the right approach is really difficult.
And just one quick note on that, home hospital can be a useful tool, especially when a student has been out for a really long time. One of the things that I really enjoyed about my time working in districts was I had the opportunity to kind of think creatively, and use home hospital time as an opportunity for exposure. So when we had kids on home hospital, it might start where a teacher was going to their home and providing instruction. And then we would move to, maybe they were providing it at the park that's next to the school. And then maybe it was they were providing it in a multi-purpose room or an office room. So it can be very useful. What we want to try and avoid is just an open-ended home hospital until they feel better. That just makes it really hard for the student and for the district.
And there's no plan for getting them back to school when you do that.
Exactly.
By the way, what we're talking about is called the Home and Hospital Instruction Program, where students with either it has the hospital name because sometimes it's literally a physical illness, kids that have chronic diseases that end up in the hospital for a month or two, they have to have that instruction. It allows, with a medical note, for them to get instruction at home or even in a hospital just outside of the school district for a defined period of time. Right.
And that defined period is really important.
Exactly. And knowing when that is the challenge. So let's talk about now what you do also to help people. I want to now branch into what the treatments that you and people like yourselves do for children and students with anxiety, and specifically in the school triggered area, school avoidance, school refusal. Let's talk about SPACE and tell more about what that is and how that compares to other more traditional anxiety therapies.
SPACE stands for Supportive Parenting for Anxious Childhood Emotions. It was developed out of the Yale Child Study Center by Dr. Elie Leibowitz. He has a book actually called Breaking Free from Childhood Anxiety and OCD, and it's written for parents. So it's very readable, but it outlines really the whole treatment approach. It's excellent. The premise of SPACE is that parents do things with the very best of intention to support their child's anxiety that in the long run may actually reinforce it. And we call these things accommodations. A lot of times families come to me and they have a student on an IEP or 504 plan and they say, wait, I thought accommodation was a good thing. And they're different. So in school settings, we think of accommodations as things that help kind of level the playing field for our students. In terms of anxiety, they are things that actually reinforce that anxiety pattern kind of going round and round. And so part of what I do, a big part of what I do, is support parents in understanding how they may be accommodating their child's anxiety at home and around school, and then ultimately working at reducing those accommodations after we have also taught them new supportive language. And the supportive language is all about validating their child's feeling, but also expressing the confidence that despite that feeling, they can handle it, they'll get through it, things like that.
When I first learned about space, which actually was recently, just in this last year, in fact, this came up in a recent video I did with Andy Cohen about OCD, it's got a role there. To me, it solves two key issues that I didn't really realize we had a solution to. One is that a lot of times when kids and students are in therapy, the parent's not very involved in that. Or they come in at the end for a quick little, here's how it went, as opposed to giving me tips for how to help my child. That's one thing. And the other thing is that it's hard to get kids to talk about their anxiety because it's making them face their fears. And a lot of them, I can't get some of them even into the therapist's office because they're so avoidant. And it helps parents help their kids. To me, those are really the two key benefits. Is that right?
And especially with school refusal, it is often that a student also has autism or ADHD. And for those populations, we know in childhood, CBT is just not as effective for them. Kids with ADHD have significant deficits in their nonverbal working memory. And so it makes it hard for them to draw on past experiences to talk about in the office. It makes it hard for them to apply learned skills to real life once they're out there. And so I just love space because I think that it gets at the heart of the problem quickly. And it's not uncommon for me to exit a family in like 6 to 10 sessions tops. And so it's just, you get such a bang for your buck with it. I'm a big fan. So
I like hearing when a person is a provider likes to do the sessions and get them out. Like it's not like a sink where you're never going to let them go. I think as parents, we like that, right? Because your goal is not to keep them forever, ideally. But if you need to, you need to. But by the way, CBT is cognitive behavioral therapy, which is more of a tradition. It's kind of I guess I'll call it maybe the gold standard evidence-based for anxiety that really involves not the parent so much, but the patient. Right. So that's why this is a nice alternative. And maybe the two of them complement each other really well, I imagine.
And yes, absolutely. If you have a child who's in therapy and they're participating and they're doing well, then absolutely, by all means, continue. Space is just such a nice add-on so that when those anxious moments come up, you know exactly what to say and do, or not say and not do in those moments.
And there's actually evidence, in fact, I learned this from you in a recent talk you gave about the evidence that they work pretty equally well. CBT and space both can have pretty equally good outcomes, I guess is one way to look at it. Is that right? So how successful is space? What do you think is a success rate that you see with that? It's probably tough because it really, obviously situations are very different. Tell me about that.
I mean, I would say it's highly successful. I think, there have been cases for sure where reducing the accommodations is very challenging for parents for many different reasons. But I would say overall, highly, highly successful. School refusal cases of mine tend to take longer than those 6 to 10 sessions that kind of a general anxiety case might take. But that's usually because there's a lot of planning involved with the school team. There might be documenting a gradual return to school plan on an IEP or a 504 plan. And so having to kind of circle back to what that plan is and change our exposure steps every week, that can add some time. But overall, I would say space is highly, highly effective.
Excellent. I'm so glad I learned about it. I wish I knew about it. Actually, when was it first developed?
I want to say in the early 2000s.
So it's been a bit.
The early 2000s, I did a town hall recently with several local pediatricians, and none of them had heard of it either.
Amazing.
And I had contacted Dr. Leibowitz and just said, I'm working really hard to disseminate
Get
this
the word
because
out.
nobody knows. And it's just so effective. And again, time and money are important to families. And so when we can support them with making something not take forever and be really cost efficient and have really meaningful change for their kids, that's something that should be out there. So
I want to talk a little bit more about how important it is to coach parents through, I want to say lessening, maybe withdrawing accommodations gradually. Like my concern is that someone might listen and say, honey, we've been doing it all wrong. We're now going to be tough. There's a new sheriff in town. And boom, it's like, from one extreme to the other. That can make things go boing, right? So let's talk about that. How they need the guidance of someone like you to help through the process.
Yeah, well, first is understanding how if it's a 2-parent home, understanding how each parent approaches anxiety. In space, we call this the spectrum of parent support. Some are in space what they call more demanding, where it's that, kind of tough love, like suck it up, you're fine. And then others lean a little bit more what we call protective, where, I just don't know. I think this might be too hard for you. I don't want you to be overwhelmed. Generally, the moms lean protective and the dads lean demanding, although not always the case. But typically that's kind of how it goes. And it's actually one of my favorite sessions to do, because usually we'll start with both parents kind of finger pointing. And, well, if you would
that never happens in my office.
Right? You would just stop doing this, or you would just stop doing that. And at the end,
I shouldn't laugh, sorry.
At the end, I say, great news. You're both right.
Nice. I'm going to use that. That's
yeah.
good.
And I teach them we have to come into the middle. So your side of they can handle this, you are right. They totally can handle this. And your side of I don't want this to be too much and their feelings are valid is also right. We just need to put those together and make that a very cohesive statement. So that's actually where we start before we go into accommodation removal. We increase support. So anytime a child is expressing anxiety or a parent can identify their child as anxious, they're going to use a very supportive statement. I see this is really hard for you, but I know you can do this. Or I know you really don't want to go down that water slide, and I know you can handle it. Really, I think a lot of times what anxious kids are missing is this belief in them. We've gotten so used to trying to protect them and trying to kind of tiptoe around their feelings or trying to prevent anxiety. We call those elimination strategies, and they're just not helpful because life is full of anxious moments, right? And so we actually have to teach kids how to move through those moments. Yes. And again, learn that something that's really scary is scary, but it's not dangerous, and they can do it. And
not necessarily protect them from them or help them avoid, because we feel instinctively that's what we want to do. We want to save our children from negative feelings, negative emotions. And you and I talked briefly about this the other day, that I felt like through my career that, there's a pendulum that swings in all worlds, including this one, where I feel like parents nowadays often hear avoid negative emotions at all cost.
Right.
Which, to a point that's good. I mean, maybe in my era I grew up, there were too many negative emotions, right? It's
exactly.
I think of timeouts, which is now like medieval in some circles, But a lot of the concepts are still there. Maybe the approach is different. So I guess what I want to touch on is that I want parents to hear that it is okay to a point to let their kids feel those negative emotions, but you said it right, acknowledge it, but rather than save them from it, I'm here to help you through this. You got this, you can do it. And if you can't, then we'll get someone to help. But talk a bit about that it's actually part of, I think, and if you disagree, feel free, it's part of building resilience to be able to overcome those negative emotions, not avoid them.
Absolutely.
Right?
And I mean, I would say in the last 10 years, there's been so much energy on connection building and validating, probably over-validating feelings, and just kind of talking about feelings ad nauseum. There was actually an article in New York Times recently about how the mental health world is being harmed by the over-discussion of feelings. We talk so much. We know that kids in schools these days are getting more social emotional intervention than they've ever gotten before, and yet we have this huge mental health crisis happening. And so it really is a matter of acknowledging that these feelings happen, and we can't let them shrink our world. We can't let them prevent us from doing the things that really matter to us. And so, yes, to help kids build resilience, it's not about avoiding the things that are hard. It's about acknowledging that those things are hard and figuring out how to move through them.
Yeah, like I've learned a lot about, you mentioned the word emotion coaching earlier, which wasn't in my lingo 20 years ago. It's taught me a lot.
Yeah.
And even as a parent, I wish I had done a better job of that. I mean, I kind of grew up in the era of the tougher love approach, and I think my daughters turned out mostly okay. But my point is that I think there's a happy medium is what I'm getting at. You don't have to, they're the extremes of, spare the rod, spoil the child from a couple, 3 generations ago to now protect them from all negative emotions. And it's almost like you're tiptoeing on eggshells. Am I right?
Well, and we can really keep kids stuck. If all we talk about is how they're feeling and what's making them feel that way, then what, right? What do we do about that? And that, I think, leads to a lot more anxiety and insecurity for kids.
And this is a good segue into, about now what we do when kids are the next level with not just like anxiety at school, the phone calls, missing a few days, but they're missing a lot of days.
Yeah.
And they're not just, they're avoiding it a lot. Like I think of a lot of preteens and teens that they wake up Monday morning, I don't feel well. But they're lacking objective symptoms of being sick. I see that a lot in my office. And the parent wants to come in and say, some of them are like really worried about that. There's like some are like, look, they're kind of telling me on the side, can you see if this is something medical? Because I think he just doesn't want to go to school. And so let's talk about how we support families through that when their kids are really resisting going to school, or even frankly, just full-on avoidance. How do you help people through that stepwise approach?
Yeah, well, the way that I do it is with a space model. So again, we start out with psychoeducation on anxiety and how it's a very interpersonal relationship with kids going through that anxiety cycle. And then hopefully we've built a team with school, and hopefully there can be some collaboration there, and we can build this gradual return plan. And that's really where something called exposure and response prevention comes into play. ERP, it is kind of a branch of anxiety treatment and CBT, where we're basically facing our fear in a really small step, where we might feel a little bit anxious, but we're not like flooded with emotion about it. And the idea is that we get through that anxious moment, we realize we can handle it, and then the next time it doesn't feel quite so hard. And so, school refusal is one of those things where no two look alike, because there are so many factors at play. There are cultural factors, socioeconomics, the support level of the school. What does home look like? Are there any other diagnoses in the child, right? There's so many different things, but generally speaking, we want to build that return to school plan where they're getting a lot of good support at school. Maybe there's a different type of drop off. Maybe they're not actually going at the beginning of the day. When I work with families with kids who have been out a long time, I try and start them at their most preferred time. So if it's recess or lunchtime, okay, let's start there, and then we'll either build forwards or backwards, because we just want them in the door. For some kids, it actually just looks like getting to the parking lot and sitting in the parking lot for a few minutes. Or it could look like walking into the office and handing something to the school secretary. So it's really variable, but a very structured, stepwise approach is really important, and those absolutely can be written into 504 plans or behavior plans in an IEP.
Okay. So it is really case by case, and sometimes the gradual method has to be really gradual depending on the severity of the problem.
Yes.
But it seems to me like parents really need a coach to help them through this, right? Because this is a tough space. And like I said, it's been a challenge for me to decide how long does the child need to be out, when are they ready to go back. It's, in some ways, it's not a medical. If it was like a disease, I could do that.
Yeah.
But when it comes in this space, it really is a gradual case by case situation.
And I would say if they are not in crisis, I would be wanting to do something now. Whether that's just going to the school parking lot, just going to the office, just maybe going to a teacher to hand them their work for the week. There is nothing wrong with starting with these really small steps, even if a student is dealing with some pretty significant anxiety. As long as they're not in crisis, those baby steps really do matter. The other thing I would want parents to know, because many of them have been dealing with this for months, and so they anticipate it's going to be months and months until they're back in school. That is not always the case. I have had plenty of times where, and actually this is really common in like my middle school girls, where they are hesitant to go back because they are worried about what their friends are going to say or what their teachers are going to say. They're going to say, where have I been? What's been going on? And they might.
There's a bit of a shame factor involved in that, right?
There's a shame factor.
Yep.
And some avoidance, like how can we avoid that conversation? And so we can certainly put some supports in place to encourage at least the adults from not overly asking. We can only do so much with peers. But the other really important thing is to prepare kids for that conversation, because it may very well happen. And what I have found is that it does happen and they survive, and then they're good. They're kind of good to go.
Wow.
And they get back into school a lot quicker than we ever would have anticipated, because that worst case scenario happened and they lived to talk about it.
And sometimes I'll add on there too, you touched on this, but I want to kind of dive into a little more, which is part of the solution for many of these kids is that there is another, it's not just school avoidance because I don't like school. It may be, but there's another factor. For some, it's a significant anxiety disorder that's not being treated. Or I've seen two children lately who had significant ADHD that was not yet treated. And when school is a bigger stressor than usual, the avoidance factors up. So sometimes part of the solution is all of this, plus let's talk about, should we manage their ADHD better? How can we manage their anxiety better, aside from just the plan to get to school, right?
Absolutely.
Otherwise you hit a wall and they just can't get over that, right?
Yes.
Have you encountered many, I've only had a small handful, any, in particular I think of high school students who are so avoidant, they'll even refuse to do their homework.
Yeah.
I mean, to me, that's even the next level. Now they're in their safe environment, but they're not even motivated to do their work. Talk about that.
Usually when that is the case, there's also pretty significant technology use at home, where they have maybe become kind of sucked into some type of virtual world, whether that is, different apps on a phone, video games, things like that. And so they are fully invested in this virtual world. And when that is the case, it really does involve supporting parents in establishing some boundaries. That's actually one of the treatment components of Space for School Refusal, just in general, is limiting electronics. Because it is so easy for kids to kind of escape how they're feeling on technology. So yes, that is definitely a thing.
Some kids prefer the virtual world over the real world, which is really just breaks my heart to see that. I'm sure yours too. And I think that also, what about? Do you find that a lot of these children are also depressed? I find that the ones that even beyond anxiety, they're just everything, nothing matters, nothing.
Yes. And I think that it's kind of an anxiety to depression pipeline, because when we're anxious and we're avoiding things, our world is shrinking. So we're not doing the things we used to do. We're not seeing the people we used to enjoy spending time with. And so of course we're going to start to feel depressed. And I think the really important thing is to not let, as professionals, not let that take us down a game of whack-a-mole. Let's treat the root issue, right? Instead of, okay, now let's treat the depression. No, let's treat the avoidance piece, because when we treat that, that's when we're going to see gains in these other areas too.
Gotcha.
So I'll usually recommend putting plans in place where, it might be really minimal expectations of leaving the house, even if it's not school. It's going for a walk, going to Starbucks, things like that. For kids with social anxiety, where they have that fear of judgment, it might be, we're going to go and order a drink. We're going to go order a smoothie. So they're still getting, again, those reps of practice of putting themselves out there. So.
And it makes a good point that for some children, there are different trigger points or times of the day that set them off. It could be lunchtime, it could be math class, it could be, things like that, right? So starting with the ones that are not so triggering first and then working on the big one later. Is that right? Yeah. In our last, several minutes here, I want to kind of pivot back to one thing, which is let's now back up and say prevention. Let's spend a little more time on that. You touched on it earlier, but so let's say a parent sees the early warning signs in their child of some of these things, but they're not yet avoiding and refusing.
Yeah.
I think of one example of I got asked, someone told me recently, asked me recently, how do I get my children to talk more about their school day? It's a big one. I remember with some of my daughters, I don't want to call any names because one of them works with me. But anyway, I'd say, how was your day? Fine. Anything happened? No. Are you doing okay? Yeah. Help us with that. How do you open that?
I think a lot of it has to do with our timing. So right when they get into the car is not the time. I tell people, I've done content on this too, the only question you should be asking on the first day of school when they get in the car, what cold beverage would you like to drink? Would you like to go to Starbucks? Would you like to go to Joe's? Would you like water? That is the only question. And then zip it the rest of the ride home, truly. Wow. Give them some time to decompress. If you think about it, for those of us who work, we spend, 6 to 8 hours amongst adults answering questions, asking questions, maybe getting yelled at, right? When we get home, we don't want a general, how was your day? Right? We need a minute. And kids do too. They've been faced with so many academic and social and behavioral pressures that they need some time. So sometimes getting them a drink and some snack will open up conversation. The other prime time is bedtime. So when you're tucking your kid at night, it will blow my mind sometimes how they have said nothing until it's time to go to sleep. And then it's this word vomit of everything that happened during the day. And it's not an avoidance of bedtime. It's just they are now relaxed enough.
They're ready to talk about it.
Yeah. And so give them the time. The other thing that you can try, I think, especially for younger kids, is ask a silly question. What was the weirdest thing that happened today? Or what was something crazy your teacher did today at school? Or what was something unexpected that happened? Good. That's actually a common one that I will recommend for dinner time conversation is, what was something unexpected that happened today and how did you handle it? Getting at those problem solving skills, helping kids see that they actually do have some tools to kind of navigate things. Oftentimes kids solve problems without really even being aware that they're doing it. So I want that to be at the forefront of their minds.
And I've heard it said, another tip that I just recently learned about is start by telling them, let me tell you about my day.
Yeah.
here was something weird that happened in my day, or this is something that really surprised me or really was challenging, and that might open the door.
Yeah,
and you can even ask, let's say you want to get at a certain thing for them, you can ask tell something about yourself and hoping they'll kind of piggyback on that. One thing you just said that reminded me of something I wanted to talk about. When I introduced this subject, I talked about, does your child have like big emotions on the way to school, or meltdowns, what do you want to call it, or in the pickup after school also? So sometimes I think we don't realize that the so-called, we call it restraint collapse, where they've been fighting so hard all day at school to keep in those big emotions and the struggles, and then they get in the car and out it comes. Help parents understand that.
Yeah. So for a lot of kids, and I think it's especially common again in kids who are neurodivergent, but it can certainly happen with typically developing kids, they have been holding everything in all day, and then they get to their safe place and it kind of all comes out. I think the really important caveat to this is that doesn't mean that it's okay, especially if it's turned into name calling, physical aggression. Like if it's an explosive type of behavior, that for me is not okay. And so then we would want to be putting some supports in place. Like maybe it's as soon as we go home, you go out to the backyard and you play. But it is very real. I think one thing that parents can do is really try and avoid allowing technology right away. For most kids, they need unstructured play to regulate. And putting them on an iPad or a phone or even TV sometimes can really just be more dysregulating for them. And so allowing them some time, ideally outside, to kind of re-regulate through play, especially for like elementary age, is really, really important. So I guess the two sides of it are like, don't over worry if restraint collapse is a thing, because it's very normal. And you can still have expectations around them being respectful and things like that.
And you might need to try a few things, that some things might work better than others before you get to the solution. Okay, I think I'm down to my last two questions for you. One is, what are some overall takeaways for parents? If you had only a quick couple minutes with somebody who's struggling with this, can you give them kind of the quick, what are some key takeaways from our conversation you want parents to remember?
I would want them to know that anxiety is a very normal part of life. We all have anxious moments, and our goal as parents is not to help kids avoid those anxious moments. It's to teach them how to get through that. I think that that's the biggest thing. The other is really focus your conversation on skill building and intervention and highlighting when they have gotten through something that was hard. One of the homework assignments I'll give to parents is ask your child when they've done something brave, how did you do that? What did you do that let you get through that big scary thing? And really be highlighting those moments of bravery too, because they do happen. We're just not always thinking about them. So even if it's the little things, my 5-year-old has a bravery board. And so every time, it's just a poster on the wall, like really low budget. Poster on the wall.
Those are the best.
Yes. And every time he does something brave, he writes it on, or I write it on a Post-it note and I put it on his wall. There's no like reinforcement attached to it, although I'm a big believer in reinforcing skills. But there's no reward attached to this. We've gotten to the point, and actually it only took a couple days, where I would ask him to do something he really didn't want to do because of some fears. And he would say, can I put it on my brave board? Yes, of course you can. And he has loved seeing how big it is. Wow. We were just in Utah on vacation, and he would say, like, now I have 5 things, now I have 7 things.
He's keeping a list of what to put on his board.
So last night, of course, I'm going through it like, okay, what else were we going to put on?
Let's not forget some of those, right?
But it's become very rewarding for him. I think also because we talk so positively in our house about bravery. It's okay to be scared and do that thing. That's what bravery is. So it's not that you have to do it and not be afraid. You just have to try.
And one thing I want us to touch on along the lines of prevention, but also something I'm sure you coach people on, when a child starts showing early signs of missing school because of, let's talk about how it's important for the home environment not to be so much better than school that they never want to go back again. Like, what should a parent do when they're home for the day and they're not, quote, sick?
Yep. It can be really challenging because a lot of people work from home, or maybe they work out of the home. And so either child's by themselves or they're with a babysitter or whatever. It is really important for the home to be as minimally reinforcing as possible. So I would say during the school day, certainly no electronics, which I know can be really hard. If they're ill, that's a completely different story, right?
There you go.
But if they're avoiding due to anxiety and then we put them on an iPad or let them watch TV all day, it makes it so much harder for them to then kind of muster the strength to push through those feelings the next day because home was so comfortable. I also try and make meals kind of minimally fun. So like whatever they would normally take to school is kind of what they get at home too.
Give them the school meal at home. Fascinating.
Yeah. No like contact with friends during the school day. And then if it is something where a student's been out of school for a long time and we're in like a true space for school refusal protocol, each week we set an expectation for attendance, and if that is not met, there's no electronics for 24 hours. So it is really important for parents to understand how significant a role electronics can play. Absolutely. In terms of emotional regulation.
I have to follow this up with, so if I'm a parent hearing this for the first time, so obviously my point is that the closer school is to feeling like Disneyland, the less effective it's going to be you kind of want it to be a disincentive.
Yeah.
Like a snow day is different than a sick day, right?
Yeah.
But also if I'm a parent hearing that for the first time, that sounds mean, Kristen. Explain that. Why is that better than making home comfy because they're not feeling well?
So in the behavior world, we call these things competitive reinforcers. So school is not very reinforcing and home becomes significantly more reinforcing. It's really going to decrease their motivation for even trying. So I know that it can feel mean. The important thing is for parents to understand you're actually kind of taking a layer off of the things that are making it harder for them to go back by not allowing them to have access to all these things.
And I kind of liken it to similar, it's another extension of what we said earlier, that when our children want to avoid, our instinct is to help them avoid, make them feel better, not have them face their fears necessarily. And this is similar to that. So it goes against your instinct, but it turns out it's better for them to learn how to, you know what, I need to go to school. I mean, home's not so good when I'm not in school. Anyway, I'm exaggerating to make a point. But.
In the long run, one of the things that make me most passionate about school refusal, especially when we're talking middle and high school, is that when high school graduation happens, that doesn't mean that their anxiety is all of a sudden gone, right? It can easily turn into what we call failure to launch, where they're not able to attend college, hold a job, leave home. And so we want to make sure that we are providing as much support as possible in those earlier years.
So parents really need to know that they need obviously to learn how to manage in this space, because sometimes the answers are not intuitive, right? Even though they still are the best thing for our kids and teens. And also, you know, I'm going to help you plug you, which is that's the guidance of someone like Kristen, who can help maybe in not so many years of therapy, but really to help guide you in the right direction, how to gradually help with those accommodations, give them the tools to really overcome, which is really what we want for our kids, to build that resilience. Last question is, if I'm a parent listening to this, what are some favorite resources where they can reach out and learn more in this space?
Yeah, so the book that I mentioned by Dr. Ellie Leibowitz is Breaking Free from Childhood Anxiety and OCD. He actually just came out with a book last month. It's actually written for elementary age teachers, or elementary school age teachers. It's a great resource, again, like very readable for people who are not in the anxiety realm. That's a great one. And then my website, my new business is actually called School Capable, and it is supporting other professionals as well as families who have kids struggling with school refusal. So I have a lot of resources on that website as well.
Have you found, is there a podcast that deals with this? There's a lot about anxiety and mental health and ADHD, but...
A shameless plug for another podcast is called the Do Less Parenting podcast that I've been co-hosting with a colleague of mine. And it is not focused on school refusal, but it is all space-based. And so we've had some guests on in some like adjacent fields. And it's all around the parent support aspect, because we believe so strongly in the parent support piece. So there are many other anxiety-related issues besides school refusal that we touch on, and it's a great resource for people.
Excellent. I love it. Thank you so much for your time. Thank you. This was really great. And for everyone out there listening, thanks for your time. Hope this was really helpful to you to learn about not only what anxiety is, how impactful it can be, what are the early warning signs that your child might need that early intervention to prevent things from getting to the point where they won't get out of bed to go to school. Stay well out there, everybody. Goodbye.